Nursing staff at a long-term care facility report that Dorothy, who has dementia and has lived at the facility for 2 years, has been exhibiting increased agitation for the past 2 weeks. About 2 weeks ago, the patient's family brought in a mirror for Dorothy's room because they noticed that she was not keeping up with her appearance as she had in the past. And in the past, Dorothy had really prided herself on her appearance. A nurse entered Dorothy's room and found her frightened and staring into the mirror. The nurse asked Dorothy what was wrong, and she stated, "That old woman won't stop staring at me." Ms. Buckner, this case shows how Dorothy's environment may be affecting her behavior. Please describe how you would provide a patient-centered environment for Dorothy and collect the information necessary for her care.
I would start and meet with the patient, Dorothy, and consult with her to see where she's at and kind of meet her where she's at. I would ask her to kind of tell me how she feels when she looks at the old lady in the mirror, and try to see what kind of feelings it brings up for her. If she says she doesn't like it, and she doesn't like the old woman staring at her, I would then go to the team and to the family and kind of educate them on what she's feeling. After that, if she is not responding well to looking at the woman in the mirror, I would probably recommend that we take the mirror out of the room. And then also I'd educate the family on the process of the stages of dementia and help them understand maybe where the patient is at and what she's feeling and going through. And then just have some good open communication with the team about the different feelings that the patient's having. Another thought too would be to try to see maybe what the patient enjoyed and what the family thought were some of her highlights of her appearance, if it was lipstick or makeup or getting her hair done. And if maybe they thought that would be something that could be beneficial to help her kind of be more comfortable instead of looking in a mirror when she might not recognize that that's actually her.
Ms. McBride, what activities would this patient benefit from to enhance her quality of life and enhance cognition?
Okay, well, I'm glad you asked that. As you know, as people progress in their dementia, they lose some of their language skills. So my first assessment of that patient would be to do a speech-language assessment and further dementia staging, because you need to work with the staff to train them as to what the patient's able to still do in terms of communication. Now, this particular lady had not been grooming very well for several weeks, so this was not a sudden onset. The mirror was the trigger. However, something happened in the weeks before the mirror went up that triggered her not to be as responsive to grooming. In many cases with dementia, as it progresses, patients have what's called agnosia, loss of understanding of how to use utensils. So it might indicate a progression of her dementia. So a good thorough assessment and restaging of her dementia will help train staff so that they'll know how to better help her be functional. She may be at the point where she literally needs to have more help with her grooming than she did previously. Secondly, we would always want her to be able to remember that which she can remember. So going back to her early marriage, her raising a family, we know she has a good, caring family. They need to bring pictures in. They need to write down on those pictures dates, family names, big events, because those are the things that will remain with her the longest. Put them in her room so that caregivers coming in and out can address those things with her. put the prompts on the back of the pictures so the caregivers can read and know how to discuss the topic. What we would also recommend is reminiscence therapy in a group, going back to the era she was raised with, the music that she loved to hear and the dances or the big events of that time in her life to help her remember things.
Dr. Parrish, as the patient's primary medical provider at the facility, what next steps would you take?
Great question, Megan. When we have a behavioral change in a patient, honestly, what we hope for is that it might have a medical cause, because more often than not, if it's medical, we can fix it pretty easily. So I do think a medical workup at the time of a behavioral change is very important. Unfortunately, though, what we typically find is that those changes don't have a medical cause. But what we look at is just the entire picture. We're looking for symptoms through all 12 systems. We're doing a comprehensive physical exam. We're updating any labs that need to be updated. And we're following up with labs on any specific complaints. For instance, if the patient had a urinary complaint, we're following up with a urinalysis just to be sure that's not an intervening factor. In my experience, though, most often we're looking at a behavioral symptom of dementia, and that's going to be a more complex problem for us to deal with, unfortunately.